Dr. Boyd Haley, who is going to be speaking about oral toxicities and systemic illnesses. He is the former chairman of the Department of Chemistry in the University of Kentucky, published research scientist, permanent member of NIH bodies, and really a culture hero of the IAOMT, and mine particularly. All of us who like metabolic pathways charts, we love Boyd Haley.
The talk today is primarily about mercury and some of the things that are going on in neurological diseases that are highly associated with it. It's also, as I'm want to do, I like to bash the CDC, the FDA, and the Institute of Medicine because they don't do their job. And we're going to show that. And I think the previous two speakers probably are mild in their criticism of our government agencies versus myself. And mainly because ours is a heck of a lot more obvious. If mercury came off of an amalgam filling at the rate that Dr. Rodney Mackert, who's the spokesman for the ADA, says, you couldn't see it using this technology. It would be impossible. That's chemistry. That's solid science. So they lie. And when you do things and you try to do science, and we're going to talk about a simple set of experiments. And this is the IAOMT amalgam study procedure, primarily headed by Dr. Rich Fisher, although he just was one of the participants. So what we did, because I did this before, except when I made the amalgams, they said, well, Boyd Haley's never had any dental treatment, so he doesn't know how to put, a paste in a hole and push down on it with a prod, and so they wouldn't publish it. And we got the same results this time. So what we did is we found nine dentists across the USA volunteered to make 10 cylindrical, one-spill amalgams in a provided plexiglass mold, which I had made commercially. Dr. Fisher of the IMT, and the IAOMT paid for this, this was their involvement in this, provided new amalgam kits directly from the manufacturers to each of these dentists, and they were of different manufacturer variety. The amalgams were put in the molds by the dentist, and they were sent to me in the molds, and what I've done is we analyzed them for the amount of mercury that they release. They're cylindrical shaped. They look like a small cylinder. We allowed them to age for way over 1 month before we started to do it because Dr. Adams, when he talks tomorrow, will talk to you about the amount of mercury that comes off of a fresh amalgam. It's quite a bit. But I don't want to address that. I want to address the amount that's in your teeth right now today that you may have had in there for months or years. And so we let them age. We checked them, by the way, but they were really very high. So what we do is we put the amalgams in 10 mLs of distilled water in a sealed test tube, and we change that water daily. Just pour the water off. And you go back and forth, and you take an aliquot when you do this on the days indicated and analyze for mercury content. Now I want to tell you something about amalgams, because there are several studies out there that say mercury doesn't come off of amalgams. Mercury doesn't like water. Mercury, if it has a choice, would rather sit next to that amalgam filling than go up in the water and be equally dispersed if it's sitting in there. So if you take an amalgam and you sit it in the water for 24 hours and you start taking off a top ml, then the second ml, the third ml, there'll be almost no mercury in those top mLs until you get right down to the bottom and it's all there. So if you take that amalgam in the 10 mLs and you just gently, without moving the amalgam, just rotate it back and forth about 3 or 4 times, we did it 10 just to make sure we got it, the mercury level goes up dramatically. So when you have mercury, you have to understand, it would rather interact with other mercury atoms than with water if that's the only choice it has. However, if you agitate it, move it by chewing, breathing, clenching your teeth when you think about the FDA, you'll get a lot of it to come off. So this is the thing we use. It's a Nippon direct mercury analyzer. I can tell you how it works, but you can see the data is very linear all the way down. We can get down to less than 1/10 of a nanogram in the sample. It's a very sensitive instrument, and we run this calibration curve every day. We did this. Now this is kind of the study, and there's a lot that you can do about each color. There's Dr. Bassiano, Eccles, Fisher, Gruby, Messerman, and the yellow is that these were 3, and you can see that's a Valiant, dispersal alloy, Valiant, Valiant, dispersal alloy. And what you're reading over here is the number of micrograms released per centimeter squared per day. Now these things are almost about 1 centimeter squared per amalgam filling is what it came down to. And if you look at this, you're seeing that you're getting somewhere around 9 in many of these, and it's very consistent across as we read it from day 1 to day 25. and they're very consistent in the amount that we get. However, within each group, there can be some differences. Like here's one that's 6, almost 6 to 7 all the way across. Another one she did was 12, 13. So it appears to me, as a non-experienced person, that whoever's making the amalgam and how hard you press it in can have something to do with the excretion. But the overall general data, if we go to the next set of dentists, Paul Rubin, Phil Sukel, Williamson, and Yo, that there's something within these things about how you put the amalgam into the socket, probably how hard you press on it, how well you do that, or how you do it. I don't know if it makes any difference. That has more of an effect on the outcome than anything else, because it's very consistent. I mean, if it's 9, it'll be 9. If it's 7, it'll stay in the 7 to 6 range all the way across. But the one overriding thing that's here is that there's a lot of mercury coming out of all of these amalgams with no abrasion. In the earlier study we did, and we're doing more on this right now, if you take these amalgams out and hold them with a pair of tweezers and brush them gently with a toothbrush, a medium bristle toothbrush, this rate will go up tenfold. So we're doing this data and we're getting ready to publish it, and we're going to detail exactly how they do experiments, plus we're going to detail all the chemical traps that you can walk into if you're trying to measure mercury coming off of a dental amalgam. Because I could do this study and show you nothing. And I'm thinking about writing a grant to the ADA and tell them I can create some uncertainty if they just pay me enough money. And I can. I mean, it's the way you do things. Scientists can cheat like anybody else if they want to. But we've seen this, and this is only 3 of the 10 that each one of these have put up, but I didn't want to make the slide too complex. But what you can see right away is that the IAOMT study, we're going to shove it down the FDA and the ADA's throat about the amount of mercury that comes off of a dental amalgam. And it's simple to do. Again, it's science that they'll find some reason to ignore. But I would tell you that the only cost of doing this was the cost of the amalgam kits. And the FDA and the ADA could have done this 100 years ago if they wanted to. This is just some of the data, again, put in there, and you look at it. Some of these are 15 micrograms per centimeter squared per day. See, when you have amalgams like these dentists you work with them, you can't walk straight. Okay, the other thing the FDA says, and this is something that I know many of you sitting here know, there's no proof that mercury causes any problem. And yet, if you go to people who get die of idiopathic dilated cardiomyopathy, and this is one of the major reasons for getting heart transplants in this country, you find out in the study published in the American Journal of Cardiology in 1999 that they have 178,000 nanograms per gram. That's 22,000 times higher than the controls. And yet, our NIH, our FDA, our CDC has not requested or put out one request for research proposals to study this. This is the disease where young athletes playing high school football drop dead on the practice field. And we totally ignore this, and there could be nothing more obvious than this. And so when someone wants to say the FDA is responsible, you know, we do need an FDA, we do need a CDC, we do need an Institute of Medicine. But more than that, it would be better not to have the ones we have today if they're going to be so damn dishonest. And if they're going to stick their head in the sand when you show people absolute toxicities that are well known, well described, and they don't even address the issue because they're trying to protect the ADA and the manufacturers of different things. So you have a real question. Why don't they study this? Why hasn't this been studied? Because it would cost some pharmaceutical industries and some dental industries some money. It's just that simple. There's no other way to look at it than this. At the very least, you would do this to prove these guys were wrong, if nothing else. Here's the study where we found, done by the National Institutes of Dental Research, the Children's Amalgam Trial, where they put amalgams in children and they said, oh, we found out they were totally safe. You expose kids to mercury. And this is the data right out of their paper, Duro and JAMA, 2006. And if you look at the one where the best one, which is the creatinine adjusted urinary mercury level, you see that it goes up in the first 2 years when replacing amalgam fillings versus the children who got composites. They're the bottom open circles, the dark circles are the amalgam or the mercury level in the urine. These are all spot urine tests, which I can tell you don't mean much of anything, except it does tell you the mercury is there. And you see it go up, and then in the next 7 years, it drops dramatically. In this 7 years, the following 5 years, they're still putting more amalgams in these children. So you're putting in more amalgams, more exposure, and the exposure level in the urine, as they wanted to evaluate, it says it's dropping. Now, how do you do that? That tells you the urinary mercury doesn't mean a thing with regard to exposure. Or you can look at it like I look at it. After 2 years exposure, these children are losing their ability to excrete mercury. It's going down the more you're exposed. Now, does that make sense? You bet it does. If you go to the literature, when you increase the amount of mercury injected into a rat, you reach a level where the rat no longer is able to excrete that mercury, because mercury inhibits its own excretion because it inhibits the production of ATP, the production of heme. I mean, there isn't anything. It's really not inhibited by mercury. But yet the Einsteins, and we call them scientists, and I want to tell you, physicians, you are not scientists. And what's the problem with some of the earlier talks when they talk about this? They are physician administrators. I know I've taught probably hundreds, if not thousands, of medical doctors biochemistry and chemistry, and I know how much they know. And I can tell you, it's scary. They should not be evaluating the science because they're not taught in medical school. You're not taught scientific thought or the scientific process. And their physician administrator, the head of the FDA and the CDC, or Dr. Julie Gerberdingen, she's not a scientist. I mean, I doubt she could pass a general chemistry test. If I'm insulting, I mean to be, because she has sat there and not done a thing about any of these issues that are so obvious to anybody that knows any science that we would be doing something and not poisoning our children. So the previous slides, show that prolonged exposure to mercury vapor decreases a child's ability to excrete the mercury through their kidneys. And this is well known and it's consistent with reports of the EPA and the National Academy of Sciences that 8 to 10% of American women have such high mercury body burdens as to render susceptible to neurodevelopmental disorders any child they would give birth to. So how can you have that situation from those two groups and the ADA and the CDC and the IAOMT saying, oh, mercury's okay to put in the mouths of babies and into pregnant mothers? I mean, it's criminal. It's the only thing you can talk about it. Now, I want to tell you one thing. I have published this, and I'm going to bring this up a little bit because we talk about one of the known effects of mercury toxicity. Mercury toxicity, the reason you put mercury calomel on your itches is because mercury disrupts neuronal transmission and you stop itching. We rubbed it on babies' gums at one time to keep the pain because it kills the neurons. I mean, it disrupts them. And this is something that's so obvious to see. And in a neuron, and there have been lots of tests, and we'll talk about this to establish some of the later data I'm showing you on neurons and culture, that mercury comes into this process called microtubulin. And it's actually the railroad track from the cell body all the way out to the dendritic ends or to where you have the synapse. And mercury causes this to rapidly and totally disrupt, and this system is totally disrupted in Alzheimer's disease brain. For example, and this is a technology called nucleotide photoaffinity labeling, which I invented when I was a young postdoc at Yale. And we still sell these compounds. I have a company that sells these compounds to NIH, Mayo Clinic, and everybody else. And they do it to do what I did. Look at the difference between a normal tissue and a diseased tissue to find out, is there a change in the ATP, GTP, cyclic A-binding proteins. And if you look at a normal, I got two normals up here, and there is the photolabeling of tubulin showing that it's really viable, right here also. And as we increase the mercury level, this disappears, whereas this protein here is much less affected by mercury. This is a normal brain with and without mercury. And right here, this looks exactly like the AD brain. That protein is totally disrupted, totally messed up in Alzheimer's disease brain. Nobody argues with me about that. And I got along and got a lot of money from NIH until I started showing that mercury, and only mercury, would do this by a simple slide like this. We take all these other metals, from lead, etc. They would have no effect on mercury if you had an appreciable organic chelator there like citrate, malate, fumarate, citric acid, or EDTA. In this case, we put in EDTA 100 micromolar, and the highest concentration of mercury was 10 micromolar. And you can see it made no difference, even down here at 1.3 micromolar, almost 50, 60-fold excess. It could stop all of these other molecules or ions from having an effect, heavy metals, but it couldn't prevent mercury from doing that because mercury has a tremendously high affinity for sulfur groups, and tubulin has 13 sulfur groups in its structure. You bind one, you change the structure of it. It's like ripping the rail out of a railroad track. Or the better example is going to a store where they have cans stacked and you pull the bottom can out. the whole side collapses because the structure of tubulin and the structure of your axon is dependent on every molecule in there being in the right shape. You can't pull out one brick and have it work. You can't take one rail out of a railroad track and have it work. And so here we find in the study, something that absolutely perfectly mimics in 3 different enzymes in my initial studies, the same effect you would see in Alzheimer's disease. And our government totally not only ignores it, took away my grants because I said that. And you got grams of this stuff right here in your mouth. You got mercury being emitted from it by every way you could look at it. And our government's telling us it's okay to do this. Now, you don't have to agree with me that it's causal, but you have to agree that somebody who's going to get Alzheimer's, and many of us sitting in here are going to get it, that it's not a good idea to be breathing mercury vapor for 50 years of your life and say that this is going to be good for you. I mean, that is stupid with a capital S. And the FDA, the CDC, and the NIH are stupid. For example, last year, they published 2 back-to-back articles, whole journal articles, on heavy metals and the contribution to Alzheimer's disease. They talked about aluminum, which we use for our body deodorants. They talked about iron, manganese, copper, zinc, elements that are essential for life that we put in fortified bread. They didn't mention mercury in one thing, and they didn't invite me to even contribute an article. So if you tell me there's not a cover-up, if there isn't some push in there, I'd like to know how you do it. How do you ignore the most toxic metal known to man, setting inches from your brain, off-gassing mercury vapor every day, and don't consider that as a possible cause of mercury when it produces all the biochemical aberrancies that you see in an AD brain? That's not only my work, that's the work of several other people. Fritz Lorscheider and Murray Vimy from University of Calgary showing the formation of neurofibrillary tangles. The work from Italy where they showed the increased phosphorylation of tau, decrease in glutathione levels by mercury, everything consistent with mercury causing this neurological disease. We have to be very honest right now because we are facing a very, I would almost say a criminal element in our government. Our agencies do not work to protect us. I mean, if they want to beat me up, hey, I'll walk in and I'll debate anybody. I've offered to, and they run from you. What they do is they ignore you and they call you a lunatic and other things like that. And there's a lot of things that built this up. And the American population has to get angry because these people are not nice people. They do not. You remember when I used to talk, I was so kind to them about 5 years ago. About 5 years ago, I took off the glove and started calling them what they are. Because there comes a time when you don't take this crap anymore, and that's where we have to go. I mean, I am getting angry. I don't think they try to do anything. And they say there's no... And again, they say there's nothing... Pink disease, many of you know about this, or acrodynia. It affected 1 in 500 children from the late 1800s, about 1940. And the cause was found to be calomel, putting in the teething powders that the rich people could afford and put on the gums to make their children stop having teething problems or teething pain because it inhibits the neurons. Anything that causes you not to have pain is inhibiting some neural transmission or signaling somewhere. And when they eliminated that, it disappeared. And this disease looked very similar in the structures and some of the problems that you see in autism. When they took away the calomel, the disease disappeared. So there was a genetic susceptibility because it only affected about 1 in 500 children. We don't know a lot about it, but we do know that mercury given to infants can cause problems that most of us would not have. And through my lecture, just keep in mind, giving mercury to an infant or a young child that is not having an effective production of bile for the biliary transport system is much more lethal to them than to you as an adult who has all of your systems, your kidneys working well, your biliary transport is working well, and you can detox well. Calomel is not really a very toxic form of mercury. But down here, I want you to note ethyl mercury is many times, thousands of times more toxic than mercurous chloride. And don't look at lethality, as the previous speaker said. We're in a different modern age. And anybody that says, oh, this is just a little bit and dose makes the toxin, just really doesn't understand biochemistry. They're ignorant people. And some of these ignorant people are well-respected academics, that go around saying mercury's safe. Let's talk about the thimerosal, and Dr. Adams tomorrow will talk about this a bit, but I think it also brings home the damage that's being done to us, and it's very severe. And thimerosal, this was the active ingredient in merthiolate. the red stuff that many of you used to paint on your hands when you got scrapes. I used to paint myself up with this on Halloween to be an Indian. I mean, it was thought to be that safe. I remember doing it. I'm serious. I wasn't a normal kid. But anyway, you have to say, what is thimerosal? There's a problem. Ethyl mercury is really the active ingredient, not only in merthiolate, but on the material that we used to put on seed corn, the stuff that was shipped and caused a lot of problem in Sweden. I mean, it's very good at keeping fungus and certain things from screwing up seed corn or wheat or rice or whatever. And the reason is it releases ethyl mercury, which is extremely toxic to everything. Thiosalicylate, which is the molecule it's attached to, is not hardly toxic at all, not in any of the studies we've done. So why did they combine it to this? Because this compound is totally water insoluble. Even though it looks like it's got a positive charge on it, it picks up a chlorine and it becomes water insoluble. You can't dissolve ethyl mercury in water very effectively. So we couple it to this and we end up with this compound, which does have a degree of water solubility, and we can put it in vaccines and vaccine mixtures and use it as an antiseptic, etc. Now, the key take-home lesson, if you're a chemist, when this goes in the water, it immediately breaks down to this. You put thimerosal in any salt solution, and it will immediately start releasing ethyl mercury. And in your body, where do you think that ethyl mercury is going to go? It's not going to stay in your fat tissue. I mean, in your water tissue. It's going to go in the fat tissue. It's going to partition into hydrophobic aspects of the body. And your central nervous, when someone calls you a fat head, they're right, because that's really where most of us are the most fat. And part of the thing about this is this study, which was done in 1977, and it was organ mercury levels in infants with omphalocelesis treated with thimerosal. That means infected umbilical cords. And in this hospital in Toronto, they treated 13 children, and the treatment was to give them antibiotics, of course, and then paint their umbilical cord where the infection was with merthiolate, which contained thimerosal, and they killed 10 of them. And they didn't know why they were dying, because if you were older, you could put thimerosal, merthiolate all over your body and it wouldn't kill you, it wouldn't hurt you. I mean, not noticeably anyway, but these were infants, and they were infants on antibiotics, and they died. And you should look at the effect on their immune system, because, as I'll show you later, thimerosal is the most potent inhibitor of the immune system known. It inhibits phagocytosis, which is the first step of your immune system, where the phagocytes eat the bacteria or the virus to help you develop an immune system to it or an immune response to it. It inhibits that at 1 nanomolar, and in the vaccine, the thimerosal concentration is from 125,000 to 250,000 nanomolar. So why would you put a potent inhibitor of the immune system into a vaccine, which won't work unless your immune system responds to the protein you're putting it in with, I mean to the material you're putting into with it. So you put in a suppressant of the immune system at the same time you put in a protein that you want it to have a reaction with it. So as a result of all of this study, getting down to the end, mercurochrome and merthiolate were removed from the market by the FDA due to their inherent toxicity to infants. Let's go back to one more study that was done, again, 1975, because you read in the literature where the crack American Medical Association and some of their doctors say, oh, thimerosal can't be toxic. Look, we injected this baby with 5 things, and there's almost none in his blood after 5 days. Therefore, it's getting rid of it so fast that it can't cause any toxicity. I mean, that tells you, if you're a scientist sitting here, that these are ignorant, untrained people. Because you have to do a materials balance. You want to know, well, where did it go? And this study was done in rabbits. They used radioactive mercury on thimerosal. And 1 hour post-injection, 1 hour after they did it, the counts per minute in the blood decreased from 100,000 to less than 25,000 counts per minute, or over 75%. Its half-life in the blood isn't the 5 days that Pachero said. It's hours. It's gone. But where did it go? 2 hours post-injection, 6 hours, there was increased counts of the radioactive mercury in the fetal brain 2-fold, the liver 4-fold, and the kidney 3-fold. And yet, the Institute of Medicine and the CDC and a lot of people in pediatrics, or PUBA, supposedly know a lot about childhood toxicities, etc., said that the rapid loss of mercury from thimerosal makes it unlikely to be toxic enough to cause autism. Published in Lancet from Pachero, supported by the American Academy of Pediatricians, and there is nothing more wrong than that. You do not get rid of ethyl mercury in a matter of days, and you certainly don't get rid of it in a matter of hours. And so getting it out of your blood means absolutely nothing. I would tell you that it's not the alcohol in your blood that makes you drunk. It's the alcohol that goes out of your blood into your brain that makes you drunk. And this is no different. And this is nothing more than hiring somebody to create uncertainty about a proposal. Getting mercury out of your blood, out of your urine, and the fact that it's not there or it's there at a low level is nothing more than junk science. And it is primarily practiced by a lot of people that are supported by the American Dental Association and our CDC. So this result, the often used argument by prothimerosal advocates and mercury advocates that it clears the blood too quickly to be toxic displays a lack of a complete and intelligent analysis of the data, and we shouldn't accept it. And so we're getting these compounds, and we know that they partition. And again, tomorrow, Dr. Adams will talk about how mercury is built up in these autistic children. And so here's the big mistake. And this is the whole result of the cover-up and the people that are fighting like blazes to keep people like me from pointing out the toxicity of mercury. And this shows you the total lack. I tell my students when I teach a class called Mercury Science and Politics that bureaucracies don't have a heart, don't have a brain, and that's real obvious, but they have one hell of a survival instinct. And here's what we're seeing now is damage control by the FDA and the CDC, because they decided after that data where you killed 10 or 13 children with umbilical cords to put the aerosol in a baby that would be EPA safe if the infant weighed 275 pounds. And the EPA safety is from data from the Faroe Islands where the children ate the mercury. And 2/3 of our mercury binding capacity or protection is in our intestines. When you breathe mercury vapor or when you inject organic mercury into a human being, you bypass roughly 2/3 of the metallothionein in your body because it doesn't go through the intestines. We have no protection. We lose our protection at this time. And so I think that's one of the problems we have. And now we come up with the current situation. Drugs used to treat behavioral disorders, autism, attention deficit, hyperactive disorder, etc., has increased dramatically, 369% in the recent past, to now where we spend more money on these drugs than we do on antibiotics and asthma drugs for children. Of course, this is all in our mind. The doctors are better at diagnosing the need for these drugs. That's what they tell us. It's not because we have an increase, because of the new vaccine policy. And so we now have 1 in 6 children in the USA have a diagnosed neurodevelopmental problem, according to the CDC. About 1, and that's an error there, it's now 1 in 150. And if you go to the right places, it's 1 in 84. Children have autism. Now, I do a study. I mean, when I'm with, there aren't that many autistics in this thing, but I always ask the parents when I'm giving a talk at an autism meeting, how many of you have an autistic child, you know, and there'll be a huge number of hands go up. And I'll say, now, stand up if you have an ancestor that's over 20 years old that have autism. Nobody stands up. And yet our government will argue with you, and our medical associations will argue with you, us, that there's not an increase in autism in this country. I have lost all respect for these people, and I think if somebody doesn't say that, you know, they are going to go around saying, oh, we're widely respected. I have no respect for them. Unless they stand up and fight for this and say, let's discuss it openly, I have no respect for these people. We have a major problem, and our FDA, CDC, NIH, and the American Medical Association ignore the effects of dental along with the ADA, and we should not have any respect for them. And as long as you treat them respectfully, they're going to continue to crap on you. This is done, you know, Educations with Disability Act from 92 to 93, 2,000% increase. In the state of Kentucky, where I'm from, it went up 2,589%. If you look at some of these others, depending on what I say, I mean, like Illinois, it went up 75,000%. Illinois only had 5 people recognized with this in 92, 93. But you can see that we are now spending a huge amount of our budget taking care of autistic children. And if you think it's only the autistic children that have suffered, and they say, well, you know, I can tell you autistic children don't take the SAT test, the Scholastic Aptitude Test. I've been on committees to give away scholarships. We had to add 100 points to the SAT test to get young people to qualify for scholarships going to college. So our brightest kids aren't as bright as they would be If that, and I know some of you sitting in here that have children, and you say, I don't know what's wrong with him. He just has no ability to concentrate for any period of time. You know, he has you know, social problems, etc. We have damaged a whole generation of children, and the only way we're going to reverse that is if we accept what caused that damage and work to develop something to reverse it. Thimerosal, again, you come back down to the molecular level, and this is something that the CDC and the IAOMT totally ignored, just totally dismissed. This crap is toxic to cells, neurons, and everything. If you add that, there's the tubulin that's knocked out in Alzheimer's disease brain. Here's that 46 kilodalton protein that's not affected in Alzheimer's disease brain. But if you add the lowest level of thimerosal we added in this particular slide, it totally wiped both of them out. It is an incredibly toxic. It's more toxic than inorganic mercury. And it doesn't have to break down, does not have to break down to inorganic mercury to display a toxic effect on neurons. And we can show you that in a little bit later. If we take this and we compare thimerosal in a system with just pure enzymes where there's no conversion of it to inorganic mercury, because they always say, well, how fast does it get converted to inorganic mercury? Doesn't have to do that. All it has to do is release ethyl mercury, because here's thiosalicylate. It's not toxic at all in this particular test. Thimerosal wipes out these enzymes that are critical for human life very quickly. And if you go over here to mercury, it does it, but it doesn't do it nearly as quickly as this or at the low concentration. So ethyl mercury released in the form or added in the form of thimerosal is much more toxic in a biochemical study than mercury itself. So we have to worry about this, and there is no way that any sensible person would say, I want all of you to go vaccinate your children against the flu at 6 months of age and give them the amount of thimerosal that would be safe if they weighed 275 pounds. I mean, that's criminal.